So we looked at the timing of the implementation of medical marijuana laws, and we found that that was associated with a decrease in educational attainment. So whenever the laws changed, we know that something happened that negatively affected educational attainment in that state. At the individual level, individual students were less likely to complete high school, less likely to go on to college, and less likely to get a college degree. Several states have medical marijuana on the ballot this November. It's potentially troubling that we don't really know much about how it affects people, what the unintended consequences might be, even though there are legitimate reasons why, for allowing medical marijuana. There are also good arguments for marijuana decriminalization as well. But that doesn't mean that it couldn't negatively affect some portion of the population, especially young people. So we already know at the high school level, there's already some research out there that suggests that 4% of 12th graders are using marijuana, medical marijuana, that was prescribed for someone else. It's not likely that we're talking about individuals who are prescribed. We wouldn't have seen the magnitude of the effect that we saw if it was just limited to people who were prescribed. Part of growing up is making mistakes and hopefully learning from those experiences. What's troubling to me, though, is some mistakes seem to be more harmful than others, and I think early drug use is one of those. Because we know that while the brain is still developing, the drug use can be especially harmful. Alcohol use as a teen, marijuana use as a teen, other drug use as a teen, beginning smoking as a teenager can negatively affect someone for the rest of their lives. Even though there are legitimate reasons to allow medical marijuana, even though there are legitimate reasons to pursue marijuana decriminalization, we know from the lessons that we've learned from tobacco and from alcohol that even though those drugs are legal, that teens are negatively impacted whenever they use them. Even as societal attitudes about this change, we need to still remember that this is potentially harmful.